Oh,
Eh, Hi, YouTube. And we are going to be live. Let's see, is this the highest it goes? Okay. Uh-oh. We're gonna be live on. Let me make sure my face isn't shiny. Hi. Yeah. All right. We're live on Instagram. Hi. Hello,
I
hello.
don't see us on
Welcome
this.
in.
I
I
don't
just
see.
started on Instagram. Um,
I don't see us on Instagram up here.
Hi. How are you all today? Happy Friday.
Happy Fridays.
I just put oil on my face. Now I feel like it's shiny. Here
It
we
doesn't
go.
look shiny to me.
No?
Yeah, it
Okay.
doesn't
Thank
show up.
goodness. Thank goodness. It's all in my head. All
It
right.
is.
Happy Friday, Moses Rains. Happy Friday. Hi, Karen.
I still don't see us on Instagram though.
You want to refresh
Oh, that's right.
the feed?
Yeah, let me try that.
Hi,
There we
Real
go.
Marquins. Happy Friday. Any plans for the weekend? All right. Y'all, I'm dealing with a shiny face here. I like hopped right out the shower and right onto the live.
There
So
we go.
if I look a mess, that's why.
So weird I have to refresh every time.
All right. I have Dr. Q here. And if anybody has a first question to start us off with, feel free to go ahead and share it. If not, let us know where you're tuning in from. I want to call out some cities over here. Oh, you just got out of the hospital? Did I understand that correctly? You just got out of the hospital? Hi, Dr. Q.
Hello. Hello,
Hi.
everybody.
Okay. I guess we're ready. Oh, Louisiana. What part of Louisiana? Oh, Kenya.
Oh, Kenya. Hmm.
Kenya's on my bucket list. They're having a sickle cell conference in
Oh,
Kenya. Hopefully you know
really?
about that. Yeah, and the person who's tuning in for Kenya, I think it's next month.
Oh, you can
So,
go on a safari in Kenya. Go out and see the animals on the
that you
savannah.
can. All right. We got Virginia, we got Philly. We
Oh,
always have Philly.
we have someone from India.
Someone from India, that's amazing. India is also on my bucket list. Dr. Q, you've been to India.
Yeah, a few times.
A few, I didn't even realize it was a. You said New
Yeah,
Orleans, of course. Duh.
yeah.
Why wouldn't? Oh, we got Congo. Sorry, my voice cracked there. Hi, Congo. My husband is Congolese and I'm Nigerian. Ooh, we got Florida. We got a great selection of people here today. Um, so does anybody want to start us off with a question? Can also take a look at what questions are sent in, and that can get us started here too. Um, here's a question. If I don't see one, here's a question. What should I do when my hematologist tells me my chronic pain is not that bad?
How does he know?
Ooh, Oakland. I'm sorry, I got
Yeah, hi.
distracted. We're in the
No,
Bay.
I mean, pain is subjective. If someone's asking, if you go to the ED or you see your doctor and they say, how do I know you have pain? Or, that person is just kind of hassling you really because the pain is your pain. And the way I always did it, I just to believe people. If they said they had pain, and a lot of people with sickle cell disease, they don't want to writhe and, make a big deal about it. And they just tell you. So you have to accept that and treat it. If someone does that, if that's your like personal healthcare provider, that's the problem because that person isn't really tuned into your sickle cell. I don't hear you.
If I'm in pain, I make it everybody's business. Everybody must know that I'm in pain if I'm in pain. That is your business. That's my business. It's everybody around me's business. So my hat's off to you all that are stoic and kind of keep that under wraps. That cannot be me. Um, oh, we got someone from Dominican Republic. Can I come visit? I'll need some. I'll I'll need a place to stay. All right. So I have a question, our very first question sent in from the live that I'm not finding it, but I saw it come in. Let's see. Oh, any advice for a youth-led sickle cell organization just starting out? Any advice you have, Dr. Q, for that?
Uh, I think you have to be affiliated or get into, if you're not affiliated with the sickle cell program or some community, another community organization, um, then you have to, get on, uh, just it's by word of mouth. You have to start telling people, get on Instagram or whatever you do to tell people that you're where you are, when it's going to be, what the purpose of it is. I mean,
Y-
Cassandra started in my kitchen.
That's
Yeah.
true. This program started in his kitchen, y'all. 10 years ago today,
Yeah,
or not today, but 10 years
about
ago
10
this
years
year.
ago, yeah.
Yeah. That was my advice too, is find somebody who's already doing something about sickle cell and collaborate with them because that's where you'll find most people with sickle cell. If you're gonna start something on your own and not be affiliated with anything, it's a lot harder. So, if you have a sickle cell clinic near you or a community-based organization or a nonprofit around you that focuses on sickle cell, then that would be my advice would be to um, collaborate with them on that.
Yeah, depending on where you are, you have to realize for people who have sickle cell and take you, it's kind of your whole world, but you have to realize that sickle cell disease is really a rare disease. So if you're in a urban area, then you can pull in people. But if you're in a rural area, it's really hard to get organized.
Yeah. Um, hopefully that answers your question. Let me scroll down and see if there's any follow-up. Okay. Didn't see anything. So my next question I have here, what we get this question a lot. What are the best ways to boost my hemoglobin? I need a hip replacement.
Well, if you need a hip replacement, you will hopefully get a transfusion before the standard of care is to give people who are going to have major surgery a transfusion prior to the surgery. And a hip replacement is major surgery. I mean, it's a big deal. So you would get transfusions to get your hemoglobin S or down to a lower level so that during the transfusion and recovery time, you didn't end up with acute chest syndrome or some other complication related to your sickle cell disease. And depending on where you are and how things go, you might even get a transfusion following the surgery if your hemoglobin S wasn't down or you're having some kind of complication. So that you can boost your hemoglobin with hydroxyurea or some other therapy. That hydroxyurea now is really the only approved medication for sickle cell.
Dr. Q, I can hear your support pen.
Oh, geez.
I don't know why, but
I need a little
the mic
fidget
really
thingy.
picks up on your pen, like more than your voice. I don't know what it is.
That's yeah, I'm always fiddling.
Yeah, he's a Gemini, so he can't sit still.
No.
All right. So, hydroxyurea could boost hemoglobin. It didn't exactly boost my hemoglobin, but I know it boosts hemoglobin for people. Um, and then, there's some therapies in the works right now that their claim is to boost hemoglobin is to raise hemoglobin a gram or, there's some arbitrary number if you're a responder. So there's things in the works as well to boost hemoglobin. But as of right now, what's on the market today, the best way to boost your hemoglobin, I would say would be either a blood transfusion, which, obviously you get somebody else's blood and your hemoglobin goes up, or hydroxyurea, which a lot of people claim boosts their hemoglobin. I need a hip replacement. That sounded like me back in 2023, and definitely look for a specialist and look for somebody who has done replacements with people with sickle cell before and has experience with sickle cell.
And it should be a collaboration with your hematologist and the orthopedic surgeon.
Any other way to boost hemoglobin?
Uh, there's, the pyruvate kinase activators,
Those are
mitaparvit.
the those
That
are
does,
coming.
yeah, that one will increase your hemoglobin about a gram. Although
That one's
in the studies, it didn't decrease pain, so it was basically increasing hemoglobin. And that will be FDA approved pretty soon. They've applied for FDA approval.
all right. Next question. I wanted to ask this question on behalf of my sister, so thank you for asking it. What are oops, let me pin it here. How long can a sickle cell patient take penicillin for?
Well, they can take it as long as they want, actually. But this is the deal. So, children historically, um, really historically, back like in Africa, etc., most children did not live to be on 3 years old who had sickle cell disease. So there's a lot of infections that happen, particularly pneumococcal disease, that is fatal in children who have sickle cell disease. They don't look very sick. They may have a fever, but they're really, really sick. So in the late 80s, they did a study that showed that if you took penicillin, that it didn't cure the infection. It allowed you enough time to realize your child was sick, and then you could get to the emergency room where you'd be treated with, you know, antibiotics if it turned out that they um, had an infection. So the dogma is you take it until you're about five, and then you just stop. However, you're susceptible to infection throughout your whole life. I think that once you get to be out of the pediatric, like say you're 10, by that time, children uh, or even though somewhere between 5 and 10, children can tell their parents that they don't feel good. Their parents can realize they're really sick and take them to the emergency room. Um, the interesting thing about this as an aside is that people who've had a splenectomy are given penicillin just like people with sickle cell disease because they don't have a spleen. But most people with hemoglobin SS, sickle cell anemia, or S beta 0 thal, their spleen has atrophied by the time they're 5, and they really have what people call functional asplenia. They do not have a functioning spleen, but the they don't the recommendation isn't that they get penicillin for the rest of their life or for a long period of time. So there's kind of a disconnect between sickle cell disease and people who've had a surgical splenectomy. Um, that given, you have to find someone who's willing to prescribe you penicillin. The other thing is, people used to think that, well, if you take an antibiotic, you're going to get infected with resistant bacteria and then you're going to be in trouble. Uh, but that didn't turn out to be the fact in children with sickle cell disease. But taking it after childhood is kind of iffy.
So I have a follow-up question to that, and it's personal. My sister is currently in the hospital for sepsis, and this would be the third time she's in the hospital, um, with like in the last 6 months. And my worry was that, she will build a resistance to the antibiotics since she's getting antibiotics so often. Is that a thing? And could she potentially, because she gets sepsis so often, could she be on penicillin to help prevent that?
Well, it's unlikely that she would get that, depending on what her bacterial infections are. It's unlikely
Mm,
that being treated with those heavy-duty antibiotics would make you're the bacteria that infect you resistant to those antibiotics. However, it's really unusual for somebody to be admitted for infection that frequently, really unusual. So
mm,
either she has something, you can have other things wrong with you besides sickle cell when you have sickle
yeah.
cell. So you have to be sure why a infectious disease hematologist or a hematologist should be investigating. Does she have a normal immune system? What is the reason for her being in the hospital? Is there something in the environment that she's getting exposed to that's causing these infections? Are they the same bacteria with every infection?
Mm,
Um, or are these viral infections and she just has a fever and they never actually identify what the bacteria is? I mean, it's a kind of a medical investigation if you're having frequent admissions for bacterial
okay.
infections. That's not normal for sickle cell.
Hmm? I am. Am I in mute, guys?
Yeah, I can hear you.
Everyone can hear me. Okay, I'm getting it. Somebody was telling me that I'm on mute. But you all can hear me, right? Give me thumbs up
I
if you
can
can hear
hear you.
me. Okay. Um, all right. So I have the next question here. We get this question often too. I've been suffering from leg ulcers for about a year now. It's a cycle of healing and relapse again. What can I do?
I take a deep breath because,
Yeah, that's a hard one, right?
well, it's hard because there's really no good therapy for skin ulcers and sickle cell disease. And I don't know if it's this in the same area or what, but
Mm,
once you have a skin ulcer with sickle cell disease, even after it heals, you can see that the skin over that ulcer is not really normal. It's very thin and very fragile. So it's not too uncommon to have that area break down again. And that's why a lot of people, they give you these Una boots to wear where if it's around your ankles, in order to prevent you from having more injury. And then they want you to wear high top shoes and all that kind of things. So that is one way to prevent ulcers from reoccurring. If they're somewhere else, then it's more of a problem. Um, if you're it, you should talk to your provider about is should I be on like hydroxy? If you're not, should I be on hydroxyurea? Would that help? I've had people, none of these are kind of approved, but I have had people who were on hyperbaric oxygen. I don't know if that works or not. There's never, as far as I know, there's never been a study looking at that. And some people were on chronic transfusions over a period of time in order to um, facilitate healing if they were reoccurring and very bad. And then you have to do something to prevent them from occurring again. So
I'm off of mute though.
skin ulcers are a really difficult
Huh?
problem if they're
No,
reoccurring.
I see people say
And
they can't hear me.
they're they're really an issue for people with sickle cell. Not everybody gets them, but once you have one, you've got to really pay attention to it and try to see what you can do to get it to heal and stay healed.
Okay, Dr. Q, apparently only you can hear me.
What?
Oh, apparently only you can hear me.
Really? Why would only I
Yeah.
hear you? It says you're on
Hmm.
YouTube up in the corner of my screen. I hear you on my computer. I don't know if I'm,
Yeah, not
I don't know if I'm
on,
hearing you on Instagram or not.
yeah. Okay. Can you all hear me now? My mic isn't muted.
Can people
Um,
on Instagram hear Cassandra?
I don't know. Let me go ahead and pin the next
Oh,
question so
somebody
that,
says I can't hear her.
yeah.
Yeah.
Let me go ahead and pin the next question. They don't necessarily need to hear me, but if you don't mind just sharing that the next question is pinned. The next question is, what do I do if I don't want to be on pain medication anymore?
Well, if you don't want to
Just
be on pain
if you
medication,
can you, Dr. Q, can you let them
yeah,
know that the question is pinned?
that one, I've been suffering from leg ulcers.
Oh, no, 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 the one that I just read right now. That the one about if you don't want to be on pain medication anymore.
Yeah. So if you don't want to be on pain medication, you have to, people with sickle cell disease need to be on medication. And right now it's hydroxyurea. So if you aren't on hydroxyurea, then you should be on hydroxyurea. You need to have a hematologist monitor that. And there's two ways to give hydroxyurea. Some people pick a dose, like 20 milligrams or something like that, and that's the dose they give you all the time because it's safe, they don't have to change it, etc. Other other people, other physicians will try to give you the maximum tolerated dose. And what that does is they look at your white count and they keep increasing the dose until they see a change in your complete blood count. And then they back if it's if it's not too bad, they will just leave it at that dose, or they might back off just a teeny tiny bit. But then you have to have sure the maximum tolerated dose, you might have to have your blood drawn every couple of months just to make sure that everything is going okay. But that would be the only well, the other thing would be, depending on how bad your pain is, et cetera, you could be on exchange transfusions if it was that's like pretty radical, but I did have patients on chronic exchange because we had a big exchange program on chronic exchange transfusions for pain. Some people were put on exchange transfusions when they were really small because they had an abnormal TCD, and some of those patients never came off of transfusions. And so, and they never had any pain, of course. So the only thing is hydroxyurea or blood transfusions that is going to eliminate pain so that you don't have to be on opioids, if that's what you're worried about.
All right, I'm gonna go ahead and start the li restart the live. So would you mind coming back in, Dr. Q? I'm gonna
Sure.
restart the live.
Okay.
All right.
Okay. It says live video ended.
Okay, it's getting ready to go live again. Hopefully that helps. That's never happened to me before.
No, this is unusual.
Okay, hopefully people can hear me. I'm back on live now. Hopefully y'all can hear me. Hello, hello. Welcome back. I am, hopefully you can hear me. Can you give me thumbs up if you can hear me?
Let's go with my Instagram.
Join the Journey podcast. You can hear me? Did I fix it? Oh,
I
perfect. Thank you. Thank you so much. Sorry about that. That's never happened to me before. I wasn't mute or anything, so I'm not sure what happened. Um, so we'll just wait for Dr. Q to come back.
right. I'm trying to do that, but it doesn't.
Do you want to refresh the feed again,
Yeah,
Dr.
I
Q?
did, but
Oh,
it's
okay.
not
There you are.
cooperating.
It says you're online now, or you're
Okay.
on the live.
Am I? I don't see myself, but
It says you're on, but let me ask a request for you to add you as a moderator.
there we go. I sent you a request, but I
Okay.
can't hear you on Instagram. So I did send you a request. There we go.
Okay.
Okay, we're back.
We're back. Sorry, so sorry about that. I'm not sure what happened. Um, the next question, did we finish answering the pain medication, right?
Yeah,
If you don't want to be on pain medication
yeah,
anymore.
yeah.
I think it's we get this question a lot, which is kind of um opposite of what, a lot of people perceive the sickle cell community to be. They think we want to be on pain medication. And so for people to ask, hey, how do we not be on pain medication, just goes to show that a lot of providers and people just in general have the wrong idea about sickle cell. So thanks for asking that question. The next question that I have is getting the port a smart move?
If you want to be on, if you're getting, I assume there's some reason for it. Like say for if you want to be on chronic blood transfusions or exchange or something like that, then a port, there's pluses and minuses. So the plus is you have a port so that you don't, depending on what, this is an under the skin port, I'm assuming, so that you always have venous access. As long as you're getting accessed by people who know what they're doing. For instance, just the people who are in the transfusion unit or the day hospital who are used, the nurses do this all the time, so they're good at it. If you go to an emergency room, they may not, the nurse or whoever's starting that port may, they probably, maybe they do it once every month or whatever. And so there's a possibility that you can get that port infected, which is not good, of course. So that's one issue with the port. The second issue with the port is, and we had this problem, is that they get small little clots in the at the end of the port, and so you have to have a medication put in there to dissolve that clot and in order for you to get an exchange transfusion. So having obstructed by a clot and infections are the bad downsides of having a port. The upsides is you always have venous access, and if you need something like an exchange transfusion, that's possible. We didn't have we had a fair amount of people on ports. We never had any problem with them, except, as I recall, I think there was at least one patient who had to have the port removed because it got infected during, like, in an emergency room or something like that. So if you have a
But
port, I wouldn't let anybody except a nurse who knew how to do the access the
be,
port,
be
access it.
protective over it.
Right. So, and of course, you're in the ED, they're having a hard time starting an IV. They're going to say, oh, you've got a port. Let me see if I can access your port. Well, if they don't do that often or they've never done it, then that's a problem. You also have to have a special needle to do that. You can't just take an IV needle and put it there, which they
And
may
then it's
not.
like a specific size too,
Yeah,
right?
yeah. So if they, and it would be unusual, well, if you're in a hospital, they can order it from the hospital, but it'd be unusual that a emergency room would have the needle that you need for port access.
Okay, great question. I have another question here. It's about exchange. They said I'm gonna try and pronounce this word. The exchange the same as a erythrocytophoresis?
Cytophoresis, yes, that's the same.
Are they the same thing?
Yeah, erythrocytophoresis is a fancy way of saying red cell exchange
You
transfusion.
doctors love fancy words. No.
Yeah, that's a real problem when you're when you're talking to doctors because they don't realize they're using this jargon and you don't know what they're talking about.
Just say
Yeah, exchange
exchange. No.
transfusion. And, and also,
All
if you're with
right.
a doctor and you don't understand they're speaking their medical gibberish, ask, say, what are you talking about? I've never heard of that. So
Yeah. What's kind of cool about those types of words, like the erythrocytophoresis,
this,
it kind of tells you what it means. Like the
right.
meaning is kind of in the word. So you guys are, I'm a wannabe language buff. I'm not good at languages, but I thought I could be at one point. But erythro means like blood cell, right? And then phoresis means something else. So you can kind of break down the words if you learn like Greek and Latin. I think a lot of the medical terms are Greek and Latin, and you can kind of you may not know what the definition is, but if you know what those words are, you could kind of figure out what they mean.
And it's also okay to ask the doctor, what are you talking about?
Yeah, yeah. But if you're just like a
I've never
nerd
heard
like
that before.
me, yeah.
Because you're
Um,
gonna, and the thing is, if doctors are busy, they'd start talking to you like they're talking to another doctor, because that's just the way they talk most of the time when they're in the hospital. It's interesting because when you're in the hospital, what do they call it? Code changing, where you're a doctor when you're in the hospital, but you're something else when you're not in the
code
hospital. So,
switching. That's what we do in the Black community.
yeah.
Um, Oh, somebody said my childhood doctor is still advocating for us.
Until I die.
He's my childhood. He's my childhood doctor. Thank you
Yeah.
very much. No, I'm playing. Um,
That goes
all right,
back.
Dr. Q, can you talk about paralysis after a crisis?
Paralysis?
Mm-hmm. Have you heard of that
No,
before?
I haven't actually.
Okay.
If they could be more specific, then I could maybe answer that
We'll
question.
put a pin in that question
Gosh, can
if you
you
can
talk about
explain.
paralysis after a crisis? But what do they
Yeah.
mean by a crisis? That is
Yeah.
that a pain crisis? Is that
Is that like after
paralysis?
being in the hospital?
Yeah, well, you could. I mean, if you were so sick that you were immobilized for some reason, you wouldn't really have paralysis, but you would have weakness. When you're in the hospital laying in a bed, forget the percent, but it's a pretty high percent of your muscle mass that you lose. It's like 2% or something like that every day. So if you're in the
Wow.
hospital for a month or 2 weeks, you're losing
Wow.
a lot of muscle mass. And of course,
Yeah.
when you get up, if you've been in bed for 2 weeks, you are weak. I mean, you would really have you'd have to kind of rehab yourself to get back to your
Yeah.
baseline. So that main if that's what if that's what the question is, yeah, if you're in the hospital, you lose muscle mass and you have to it's like you have to go to physical therapy yourself to get back in shape and all that kind of stuff. The shorter
Yeah.
period of time, the less you're going to notice.
That's happened to me where I've been in the hospital probably for about a month and I had to learn how to rewalk. And I went from the hospital straight to a rehabilitation center where they taught me how to like use my legs again and all of that. So that's very real. This person said my niece had a terrible pain crisis and now can't move her hands or legs.
Her hands or legs.
Yeah.
I mean, if the other thing is if you had a really terrible pain crisis in a knee or in a joint, it could be that that joint was infarcted and there's a lot of pain there, and you could have problems that were like avascular necrosis of your hip. You can have that in
Mm.
any joint. So that needs, if that's what's going on, that needs to be evaluated because that is a big issue.
Is there numbness at one side of the body after a crisis?
I
Or have you heard
suppose
of that?
that would be very unusual, but anything's possible. But if you have numbness, you have to be evaluated for a stroke or something to make sure that that numbness or inability to move isn't due to some kind of cerebral vascular problem, because that's really common in sickle cell. So you have to be sure that everything's okay within probably an MRI. Or you could see a neurologist and they could also determine whether it was neurologic.
So it sounds like it's not typical of sickle cell, but it doesn't mean it can't happen. So I
Right.
would follow up with a specialist
Yeah.
in regards to that, a neurologist or somebody who specializes in nerve.
Yeah,
Um,
anything that happens to you that's never happened or doesn't seem to, it's unusual like that really needs to be investigated with sickle cell disease because things
oh,
happen.
somebody said it's hard when you're having a crisis, but you gotta stay active.
Oh,
I know.
yeah,
That's like
right.
the one of the my biggest pet peeves when having a crisis, like, well, the last time or one of the last times my mom, which was a long, long time ago, I was hospitalized. My mom's like, okay, get up, get up, get up, move on, come on, let's get your blood circulating. And I would just be side eyeing her, like, yeah, that's not, yeah. So that's very real. That's very, very real, having to keep moving. But you guys know why you have to keep moving, right? So that you don't get acute chest
Right.
syndrome. You
Well,
might
yeah,
go into the
yeah,
hospital with a crisis and then develop acute chest syndrome
right.
because
That's
you're in the
common.
bed the whole time.
Yeah, that's
And,
common.
acute chest syndrome is one of those killers of, especially adults with sickle cell. So,
Yeah.
there's a reason. It's still annoying, but there's a good reason to keep moving while you're going through pain crisis. You can't
And,
stay
and
stagnant.
and if you're really in pain, even just getting up and sitting at the side of the bed, just moving around, that's what you have to do. You can't just lay there doing nothing for a week.
Yeah, there's ankle pumps like where you can sometimes in the hospital I've gotten this stuff where they can put it around your legs and it squeezes your legs
Oh,
so
right,
that the
the
blood
pressure
it
socks.
stimulates
Yeah.
blood circulation. But then also you can do ankle pumps like do this with your ankles to keep blood circulating if you can't get up. So just, yeah, there's exercises where you can do stationary, where you can still kind of promote blood circulation. So those are also a thing too.
And people who have sickle cells are increased risk for having blood clots as well. So you want to keep moving on, even if you don't get out of bed.
Yeah. Um, that was a great question. My next question is, can we discuss sickle cell beta zero thalassemia and alpha thalassemia trait. That sounds like a complex case there.
Well, uh, beta zero sickle beta zero thalassemia is an issue where you inherit the sickle cell gene from one parent and you inherit the thalassemia major, which is beta zero, means you don't make any hemoglobin with that particular hemoglobin gene. So um, it means that your hemoglobin is going to be your red cells are going to be smaller and your hemoglobin is going to probably be a little bit lower if you have S beta zero thalassemia. But because you have beta zero thalassemia, it means on one chromosome you're not making any hemoglobin. So the only hemoglobin that is circulating in your body is sickle hemoglobin. So that's why when people talk about hemoglobin SS and hemoglobin S beta zero thalassemia, they're basically putting those two diagnoses together because both of those individuals, or in that both of those cases, you only have S circulating. In S beta zero thal, you may be a little more anemic than someone who has hemoglobin SS. Um, and but that's the difference between SS and S beta zero thalassemia. There's something called S beta plus thalassemia, and that's where you there's a mutation in that hemoglobin, the other hemoglobin. You've got S, and then you've got this other thalassemia hemoglobin, but the mutation is doesn't completely shut off that that gene. So you're making some hemoglobin. And depending on what the mutation is, there's hundreds of mutations for thalassemia. But depending on what that mutation is, depends on how much normal hemoglobin you have. So there's a range of severity in people with beta plus thalassemia. They can make a very little hemoglobin and they're more like S beta zero, or they can make more hemoglobin and then they have fewer symptoms. So that's the difference between those two. Is there another part of that question? I can't.
Yeah, alpha thalassemia trait.
Yeah, alpha thalassemia trait. You have four alpha genes. So if you have alpha thalassemia trait, you could be missing one or two. Um, and that people with alpha thalassemia trait tend to have higher hemoglobins, and they tend to have um, more issues with bone problems. They don't they're at less risk for like strokes and some other things, but then they're at higher risk for like avascular necrosis. Their hemoglobin
That's
is
me.
yeah. And that's you're looking at someone who has alpha thalassemia trait.
Yeah, so it's not just you. I have a single deletion alpha thalassemia
Yeah,
trait.
yeah. Which is the
Um,
most common. Yeah.
oh, okay. So yeah, sickle cell is complex, guys. Like it's
Yeah.
not just
Yeah.
SSSC, S beta
Right.
zero. Like it's
Well,
very, very complex.
there's hundreds of different hemoglobins. There's like a book that's like this thick with all the different types of hemoglobins there are. And out of those hundreds and hundreds of different hemoglobins, some of them, when they're paired with S, can be as serious as hemoglobin SS. They can be like sickle cell disease. Not there's not that many, less than, well, I don't know, maybe 10 or 12 or less. Some of them are very rare. Some of them are not, they're rare, but not uncommon. So
Yeah. So hopefully that helps. Yeah, it's a crazy world of genetics when it
yeah,
comes to sickle cell because, you have sickle cell, but then you have alpha thalassemia trait. So and both interact with each other in a certain way. So,
I've
um,
said this before, but I had siblings and they thought one of their uh, kids had S beta zero thalassemia when actually she had S beta plus, but the mutation was so severe she made very little hemoglobin A.
hemoglobin.
And
Yeah.
on hemoglobin electrophoresis, when we didn't do the diagnosis that came with that, they
Yeah.
didn't notice that there was a little teeny bit of A. So she really didn't have um, She really had S beta plus, not S beta zero thel. Although because she had so little hemoglobin, she did have pain episodes and all that kind of stuff.
All right. The next question I have, and we're gonna have to wrap up maybe with this question.
Oh,
Maybe we can take
wow.
one more. I
It's
know we're at time. I'm need to end a little bit earlier today, guys.
yeah.
Sorry. Um, I'm 46 and lately I've been having more crisis and severe hip pain with my crisis. Should I be concerned about that? And before you answer, Dr. Q, I just want to put something out there, maybe perimenopause. And I think I'm going through perimenopause. I think I haven't been like diagnosed or whatever. So hormones like really play a big role. I'm speaking for myself, but play a big role in my sickle cell. For years I didn't have any issues, and then hormones started fluctuating, and like my sickle cell started doing something as well. So just something to think about and maybe talk with your doctor. But any particular reason why this person who's 46 has been having more crisis? Um, and is that something they should be concerned about?
Well, of course, you should be concerned if you're having more crisis. And if you're having bone pain, like I think she said she was having hip pain,
Yeah,
then you really have to be evaluated for avascular necrosis. So
necrosis. Yeah.
avascular necrosis on an X-ray, like they do a regular plain film, like a chest X-ray, but they do your hips, you can't really see the inside of the bone. If there's severe enough avascular necrosis, you can see it on a plain film. But on an MRI, you can actually see inside the bone, and you can see whether there's infarcts in the head of the femur, the round part that goes into your pelvis. And if that's the case, then you're developing avascular necrosis of the hip, and that could be why you're having hip pain. But until take a look and investigate it, you don't know. And I think Cassandra's right. As you get to be old, women who have sickle cell disease go into menopause sooner than people who don't. And I mean, I'm just kind of like hypothesizing here, but if you have fluctuating um, uh, hormone levels, that could contribute to increased pain episodes.
Okay. So hopefully that's helpful. Sickle cell also is a progressive disease as well. So this is less about, the acute crisis, but more about, just the wear and tear that sickle cell has had on you over, a lifetime. And so you'll find different complications kind of come up with sickle cell as you age. You right?
Yeah, I'm fine.
Need water?
I have a cough. Well, we're
Oh,
we're gonna end here
we're
in a
gonna
few
wrap up.
minutes.
Yeah.
Oh yeah.
Are you gonna be able to give your special statement? I
Yeah,
have maybe we can do one more question if you don't mind, Dr.
sure,
Q. Or
sure,
if you're
sure.
not, let me know. Um, that sounded like a good one. We can wrap up too.
What's the question? I'll answer
This is kind of a big question, so hopefully we can give like
it.
a a quick answer. Can you talk about the few cures that are being studied and could become available soon? And what I'll say about this is some of them are already available.
Yeah,
Um, so what else can you say about that, Dr. Q?
yeah. So there's two gene therapies that have been approved by the FDA if you're in the United States, and both of those are available right now. And Medicare has just made very expensive. They're complicated, they're very expensive, like millions of dollars. But what Medi-Cal has decided is that they will pay for those gene therapies if they're successful, which is kind of an odd way to look at it. But so if you have, and they're successful as far as I know, like almost 100% of the time. So if you were to have gene therapy and you have Medicare, Medi-Cal in California, they will pay for that as long as it's successful. Um, Otherwise, you'd have to have some insurance. Like I said, they're very expensive, but they're available. And the other thing is, if you really are looking into some what people call transformative therapy, is there are studies and there are uh, new things coming up. So I think you can look at clinicaltrials.gov has all of them on it. And I think what's our Sickle Cell 101, you can look up the new
Yeah.
studies as well.
Yeah, scdstudies.org.
Yeah.
But yeah, so there's two routes to go about this. There is, accessing the gene therapy that's already approved for sickle cell. There are two of them. One is called Casgevy, the other one is called Lyfgenia. Two different approaches to, not curing sickle cell. We can't really call it a cure, but two different approaches to transform sickle cell. It's a one-time treatment, right? Or so you can go the commercial route where you can, access what's available now. These both have been FDA approved. Or you can go the clinical trial route where they're still developing, different types of gene therapies. And gene therapies is its own world. Like there are so many different types of gene therapies and so many different ways to tackle sickle cell. Some of them target your fetal hemoglobin, so you produce more fetal hemoglobin, which counters sickle cell. Some are looking at, just a whole bunch of other ways. I know there was one that looked at fixing the actual mutation within sickle cell, and so there's different methods to or approaches to kind of um, lessen the symptoms of sickle cell, significantly lessen the symptoms of sickle cell, where it feels like um, not something you have to deal with on a daily basis. So, clinical trials, you can look at that. Obviously, with clinical trials, you typically don't pay anything out of pocket because you are a study participant. And then commercial route is, um, available with the patient services. There's a lot of help out there so that you don't have to pay that $2 million. Um, so those are the two options that are currently available right now, or the two ways to go about gene therapy.
Yeah, most of the studies on gene therapy that I know about are targeting the fetal hemoglobin gene so that you increase your fetal hemoglobin because
Yeah,
once your fetal hemoglobin is 20-30%, and in these therapies it's really high. So that's the new therapies most commonly target the gene that regulates
fetal
fetal
hemoglobin.
hemoglobin. So, or like Cassandra's saying, the actual gene, it's the fetal hemoglobin gene itself.
Hi, Derek from Cameroon. Um, all right, and then I see someone that joined us named Cassandra or Cassandra. Hi, I'm your namesake. We're actually wrapping up. Um, there was a to the person who's asking about the leg ulcer, we talked a little bit about leg ulcers earlier in the live. You might have not have been on, but Dr. Q, can you just briefly share the correlation between leg ulcer and hydroxyurea, and how hydroxyurea can be a factor?
I mean, to cause leg ulcers?
I think that there was a study that showed that hydroxyurea worsened leg ulcers. I don't know
I'm
if you're
not
familiar
familiar
with
with that
that.
study, so
Okay.
I can't really address that right off the top. But the
Okay.
person can go to ask at Sickle Cell 101, and I'll give him an answer to that.
Yeah,
But
please send that question to ask at SC101. And Dr. Q, like, he
yeah,
has 50,000 articles about sickle cell and he goes
at
through all of
least.
them and and
Well,
he finds,
there's
yeah.
another thing. People thought that hydroxyurea increased the incidence of avascular necrosis of the hips, which in other, there was one study that said that, and then somebody started investigating. Well, is that really true? And they proof that it wasn't true. So
Mm.
I will please send me go through Ask at Sickle Cell 101 and I will look it up and I will send you the answer. I just have to, I'm not familiar with like with ulcers and hydroxyurea right off the top of my
Wow, we
head.
have someone from Colombia, we have
Mhm.
Kenya, we have Cameroon.
Yeah,
You guys are so global. I want to come
it's
visit
really
all of
nice.
you.
It's
Yeah,
crazy.
this is
Yeah,
really good. The
really
whole world coming
crazy.
together for sickle cell here. Um, Somebody says, I wish I had doctors who actually cared about sickle cell in my country. All we get is folic acid. That is the case
Uh,
for a lot of places on Earth, unfortunately. But yeah, try and find somebody who can care or who cares enough about sickle cell. They don't have to necessarily be a sickle cell or hematologist. They
no,
just
I'm
have to
not a
care
hematologist.
enough about you. Yeah,
I'm
Dr.
I'm
Q
a
isn't a
I'm a
hematologist and he cares about
pediatrician,
me.
not a hematologist.
All right. So Dr. Q, you want to give us your statement
Okay,
and we'll go ahead and wrap
sure.
up.
So Sickle Cell 101 is all about education. And so what I'm talking about here is to educate you. I'm not advocating for any kind of special treatment or therapy. I'm just trying to give you the information that I can pull off the top of my head. And sometimes I could be a little bit off. I could be wrong. Other doctors might not agree with what I'm telling you. So um, if you do want more information, you could go to Ask at Sickle Cell 101. Um, but I'm only trying to educate you. I'm not trying to give you medical advice at all.
Okay, so yeah, somebody saw a post on the correlation between hydroxyurea and like ulcers. Um, Oh my gosh, someone from Equatorial Guinea. You guys are just coming in while we're leaving. I gotta go. Thanks, the paradoxical.
Well, when's our next, in 2 weeks, we're going to do,
We'll be here in 2 weeks, and if you didn't get your question answered, Dr. Q does a wonderful job of answering it. He like provides just this analysis,
yeah,
essentially on your question. So, please email ask at sc101.org and he will reply with an answer.
yeah.
We always say this, but y'all don't be emailing
No, they
us.
don't. I get very
So if you
few.
don't want to
So,
email us, then join us the next
yeah,
time. We'll be back
right,
in 2 weeks.
right.
And we'll prioritize your questions. All
And
right.
say, I'm coming back. I want my
Yeah,
question
you
answered.
tell us, well, put us in our place. We'll take care of you. All right, guys. Have a wonderful
Yeah,
weekend ahead.
right.
Drink your water, get your rest, and um, can you write an email? Write us an email at ask at sc101.org. Get your water, get
Yep.
rest, be happy, do something nice for yourself this weekend.
Yeah.
You deserve it. And we will be back in 2 weeks.
2 weeks. Bye bye,
All right.
everybody.
Thank you all. Take care.